Afternoon, I'm Devin Skillian in for Karen today. This is the moment millions of people have been waiting to see. The very first American receiving a coronavirus vaccine in New York, a scene that will play out in all 50 states, including here in Michigan. At this hour, we're still waiting for the first photos or video of patients getting the vaccine in our state. But the first doses have been arriving since this morning at facilities in Metro Detroit. It does take some time, though. The vaccine has to be thawed before it can be administered. As the vaccination program, though, gets started, the state of Michigan reporting 7,200 new cases of the virus. That number, though, a two-day total for Sunday and Monday. State also reports another 90 people have died from COVID. We've just learned the total number of deaths in the United States has now topped 300,000. Paula Tutman has been talking with a member of Operation Warp Speed for weeks, and she joins us with a progress report on this Monday. Paula.
Hi, Debbie. Yeah, it's really exciting to see Marion Wicker, who was right there. She's been in Washington, D.C. She came back to Michigan because she wanted to see the fruits of her labor. Yes, there are still lots of questions about this vaccine. No doubt about it. But also, a lot of people are hoping that this answers their hopes and prayers.
I hear of a package you want.
The vaccine arrived at Michigan Medicine at University of Michigan in Ann Arbor just around 9 this morning.
There you go.
Marion Wicker, a Warren resident on loan from TACOM to Operation Warp Speed, who's been working on logistics for months.
I flew in with my companion here, Colonel Mike Post.
Made the trip from Washington, D.C. to Portage, Michigan to oversee the first shipments.
This was the actual packing up of the soft box, the thermal box that the vaccines were shipping in. So it was filling the bottom of the box with dry ice, putting the vaccines in, filling the top with dry ice, alerting the temperature logger, and then sealing the box.
She then drove to Ann Arbor to get a sense of how the planning and actual execution was going.
There you go. Now you're going to see the. No, you don't have to pull the box out. No. Yep. Okay. Leave it sit there. See the two straps?
The intel that I'm getting is all of the vaccines are around the country are arriving thus far as they should.
Michigan Medicine is working out the kinks, making sure the process is right and watching for any possible adverse reactions or side effects. And so only 5 people will be vaccinated today and only 40 tomorrow.
It's sort of a light at the end of the tunnel. I mean, we still have a ways to go. We still need to wear masks. We still need to social distance until all of this, or the majority of us, can get the vaccine. But it was, you know, it was a package of hope.
At almost the same time in the city of New York, the first non-trial emergency authorized dose was going into the arm of an ICU nurse named Sandra.
And it didn't feel any different from taking any other vaccine.
And across the nation, glimmers inside of hallways in hospitals as precious cargo arrives via express mail carriers. Not just as a vaccine, but as the hopes and desires of so many people who see this as the first step to getting their lives back. Though it cannot be ignored that today, the grim milestone of 300,000 Americans will never return to us because of this virus.
We're starting down the getting everyone vaccinated pathway and hopefully seeing the light at the end of the tunnel for the COVID pandemic.
You know, I just don't know that we can say this enough. This is not a vaccine approval. It is an emergency use authorization by the FDA. That is different, but the manifestation is the same in this way, Devin, and that is there is a lot of excitement by the fact that this is finally going into the arms of some people.
No doubt, Paula, but since, Marion's been in the middle of all this and you've been talking to her, I'm wondering if she's seeing anything that still kind of needs tweaking, anything that they can improve on here.
Yeah, you know what? She'll be the first to tell you that there are a lot of people involved in making this happen, right? It's not just her. She is the deputy chief of the distribution and production. Okay, so that's important to say. But in following this from Washington, D.C. to Portage to Ann Arbor, she did notice that there were maybe some communication things that need tweaking in terms of communicating with some of the hospitals when they might actually be receiving some of these vaccines. Keep in mind, she is now on her way back to Washington, D.C. because Moderna is being heard on Thursday.
Right.
And she needs to start working on that. And so hopefully she can apply some of those fixes.
Which is its own then sort of parallel logistical odyssey to go through as well. Yeah, all right, Paula. Our coverage